I'm trying to create a human three-dimensional model of myelofibrosis in a test tube in the lab. And this model will have almost all the clinical features of a myeloproliferative neoplasm. And I believe if this succeeds, this would be a big breakthrough for advancing the science of myeloproliferative neoplasms. My name is Abdulrahim Yaqub. I'm a member of American Society of Hematology and the American Society of Clinical Oncology. My prominent focus in clinical practice and in research is myeloproliferative neoplasms, and that's the area that I'm involved in patient care, clinical research, and partially some translational and basic research.
Out of all the doctors that I work with, he's been the most inspiring to see that passion, and you see his eyes light up when he's especially talking to an MPN patient.
Every patient who needs therapy deserves to be treated, and there should not be any barriers, whether financial or social or access to health care, that prevents him from getting his therapy that he needs. I believe that my duty is to improve the knowledge of patients and providers in understanding the disease burdens that are not measured by a blood test, and educate the patients and their providers in how to test for them and what tools are available to improve on that.
I love when I get to run clinic with Dr. Yaqub and go into the rooms with the patients and hear that education. I get to learn every single day.
I think education is the most important part of what I do. I would like both patients and healthcare providers to know more about MPN.
That's the most important part of a job, learning every day and doing what you love.
Coralie has amazing energy and an amazing positive attitude towards everything she does, both in patient care and in her daily life. The unique thing about myeloproliferative neoplasms is that it's a chronic condition, and you might be having a few good years, but you need to know that in the future things might change and symptoms might change. Patients just are used to having symptoms. The symptoms creep on them for months and years, and they just get used to it. And that is not okay. That is not how they're supposed to live. So I spend a long time on teaching patients to look for symptoms, ask the right questions, and to try to provide the answers if I can. Having a clinical suspicion and having some clinical expertise with the presentation of the disease can help detect the conditions earlier and help interfere and help patients earlier. My focus on myeloproliferative neoplasms has given me some insight into creating a certain algorithm where I can spare patients on painful procedures if I can. And if I can get to the diagnosis without getting a bone marrow biopsy, that'll be something patients will definitely welcome. Well, I don't believe that what I'm doing is above and beyond my job as a physician. I think an integral part of being a physician is to advance science and advance patient care. So I would give all the credit to my patients. They have motivated me to work harder. They have opened my eyes into aspects of their lives and issues that need to be addressed. And they have their clinical needs actually drive my motivation to excel in my practice.
When I go in and hear you talking to your patients and run a clinic with you, I learn something every day, and to see the light in your eyes when you talk to the patients about this process, I know that you truly care deep down, and it's going to be a part of you forever.
When I do what I do, I really just think of the patient care and patient's best interest, and I also talk to you guys when I'm there. I want you to know what I know. I want you to learn this, and maybe next time you will be doing the teaching. I always wanted to do this, and I am doing exactly what I had in mind as a kid, and I enjoy every day of it. I come to work happy, I leave work happy, I enjoy every minute in between.